Good afternoon, everyone. I'd like to welcome you to the webinar pertaining to the COVID-19 Families First Coronavirus Response Act that will be reviewing the extended paid leave that employers will be required to abide by this new act associated with the pandemic for COVID-19. To introduce myself, my name is Kelly Spencer. I am the president of T. Spencer Samuels Insurance and Financial Services. We are a full financial planning firm pertaining to employee benefits, human resources, and consulting, and all topics pertaining to employers, their human resource needs, and their employee benefits, and how that affects their businesses. We have been open for 20 years, and my partner is Lisa Samuels. We are very pleased to bring this presentation to you because it is very important information that will review the requirements from employers to abide by a new Family Medical Leave Act and or paid leave structure changes associated with your business. So without further ado, we're going to go ahead and get started. We will be presenting this webinar. You will find it on your association web pages. We'll be blasting it on Facebook and other means so you can actually re-watch this. But I do highly suggest that you write down any questions that you might have pertaining to this topic. And our contact information will be at the very end of this presentation, and we are more than happy to answer any questions complimentary. We are here as a resource, and that is the main purpose of this presentation. So the topics that we're going to be reviewing today is what do employers need to know when it pertains to this new act? We're going to review the definition of the FFCRA. We're also going to review which employers are required to adhere to this updated Department of Labor law, which employees will qualify for this extended paid sick leave. We're going to review the difference between furlough employees and layoffs, and what does this mean to your company? Duration of paid leave that's required for employers to pay. How you are required to calculate the rate of pay once an employee qualifies. Some commonly asked questions that I have been receiving from employers. Reviewing the federal assistance for employers who are required to pay towards this extended paid leave. How to minimize the abuse of this new act. COBRA guidelines for employers and employees. And alternative options for your employees for health coverage in the event that they lose their coverage through you, the employer. So the first thing we're going to review is what is the FFCRA. This act was brought down by the federal government, and it was effective on March 14th of this year. And this act will actually remain in effect through December 31st of 2020. The Families First Coronavirus Response Act requires certain employers to provide employees with paid sick leave or expanded family and medical leave specifically related to COVID-19, and the Department of Labor administers and enforces this new paid leave requirements. And again, this began on March 14th and will remain in effect till December 31st of this year. So the most important question that most employers have, are they affected by this new act? So the paid sick leave and expanded family and medical leave is going to affect all employers, private employers who currently have fewer than 500 employees. One of the provisions within this act is a very broad term, and they will have expanded information on this, but they did state several times within the act that small businesses with fewer than 50 employees, this includes full-time and part-time employees, may qualify for an exemption if they feel that it would jeopardize the viability of their business as an ongoing concern. And this mainly pertains to the requirement of providing the leave in the event that there is a school closing or childcare unavailability. So some of the items you will be required even if you have less than 50 employees, if it is a qualifying event outside of that one specific qualifying event for employees. So how does an employee qualify for this specific paid leave? There are going to be 5, and the 5th one is very broad, so we'll spend a little bit more detail on that. So according to the federal government, if an employee is under a local quarantine or isolation related to COVID-19 and has been advised by a healthcare provider to quarantine, then that is the first eligibility. If the employee is currently having symptoms and is seeking medical diagnosis for COVID-19 is the second. The third is the employee caring for an individual subject to an order to self-quarantine or is having symptoms? For example, for this one, a spouse is at home under self-quarantine. The employee is subject to take care of that spouse. They may not have active symptoms as of now, but maybe they were in contact or they have been advised to quarantine. The fourth is the employee caring for a child whose school or place of care is closed? Now, this, if you remember previous slide, if you have less than 50 employees, you may be exempt from the employer paid leave if this is the only qualifying event that the employee has. And the 5th is very broad. They left this open so that if the Secretary of Health and Human Resources deemed other criteria that they wanted to add to these 5 qualifying events, they could do so without having to rewrite the act. So the 5th is basically if the employee is experiencing any other substantially similar condition specified by the Secretary of Health. And so that is actually a very broad term, but it allows the Secretary of Health and the Department of Labor to add in different criteria to let or allow the employee to qualify for the extended paid leave. So with that being said, we want to review 2 options for employers when they are considering how to handle their workforce within the new conditions of the federal requirement. So we're going to review 2 items. We're going to review what is a furlough and what is a layoff. Companies that are closed or have furloughed employees because of the lack of work are not required to provide paid sick leave or expanded family leave under this new act. So the definition of a furlough employee is the temporary leave of an employee due to a specific need of the company or employer, which may be due to economic conditions for a specific situation in the economy. This, of course, would be COVID-19, a reduction in the available work for an employer to provide the employee to maintain their hours as they currently work. With a furlough employee, you are not actually terminating this employee. You are sending a furlough letter to an employee, which I will provide a template if you'd like, that basically states that due to the economic impact of COVID-19, we are either reducing your hours or eliminating your hours for a temporary period of time, but that their position is going to be left open when the economy and the business returns to normalcy. So basically, you're saying to the employee, we are going to pause your employment. We are not going to terminate your employment. When you are laying off an employee, you're basically either closing the business down, or you're terminating all operations, or you are removing the employee from payroll. Termination means that you do not intend to bring the employee back when the economic environment improves. Why is this important? Many employers are terminating employees because they believe under the FFCRA, the only way to bypass the act for employee paid leave is to terminate employees, which is not correct. With that being said, the Department of Labor stated very clearly that employers are not required to pay the paid sick leave or expanded family leave or medical leave if the employer closes its work site and or furloughs their employees. So if you have a workforce and you have 10 people that work for you, and you intend that once the economics have stabilized and you're able to either open your doors or get back to the same level of business prior to the pandemic, you have 8 employees that you'd like to reinstate in their previous position at their current rate of pay as things start to increase. Those employees you will furlough. The 2 remaining employees you do not intend to bring back into your workforce. Those are the 2 employees that you will terminate, which means you'll be removing them from payroll. Why is this important? It is important on which strategy you actually take to either furlough or terminate, because many of the economic loan programs for small businesses have a very strict stipulation that you are going to either retain your current employees, you are going to bring them back into the workforce, and that is how they are determining how much of a loan you may request, how much you will get approved for, and many times how much or what percentage of that loan is forgivable through those programs. So you want to be very, very careful that you are not terminating all of your employees, because if they are not active on your payroll, then those payroll costs cannot be calculated in the total amount of the loan. Example, with the PPP loan, the Paycheck Protection Program, you have to have a certain number of employees reinstated into your business by the end of June of 2020. So for a furlough employee, you would bring them right back to the same position or close to the same position at their current rate of pay. And in terminate employees, you would actually physically have to rehire them. So for employees that you intend to bring back, please make sure you are furloughing those employees. Those who you intend not to bring back into your workforce, you can terminate. So if you have additional questions pertaining to this, this is a very big topic right now. Keep in mind that the date in which they are going to start measuring the termination versus the furloughs for many of the programs will be any action by the employer that took place after April 1st of 2020. Additional information on furlough versus layoffs. Just a couple questions that I have been receiving. If my employer closes the work site after April 1st, but before I go out on leave, can I get paid sick time or expanded family medical leave? No. If you as the employer close after April 1st, you will not be providing the paid sick leave or the expanded family medical leave. If you as the employer are open, but you furlough an employee after April 1st, can they receive paid sick leave? No. If you as an employer furlough your employees because it does not have enough work or business for you to sustain your business financially, those employees are not entitled to the paid sick leave. I highlighted this because I want to stress this many, many times within this presentation, this is important news for many employers because this means you do not need to lay off your entire workforce or terminate and remove employees from your payroll to avoid having to pay this sick pay or extended family leave. So that's very, very important. If you have questions associated with your business specifically, please reach out to us and we will help in any way we can. So let's review additional benefits of furloughing your employees. Many employees are concerned that if they are not terminated, they will not be eligible for unemployment benefits. That is not true. Number one, furlough employees do qualify to apply for unemployment. As the employer, if you offer group health insurance benefits to your employees and you furlough an employee and they need to retain their health insurance benefits, they will be eligible under COBRA guidelines to keep their benefits, but you as the employer will not be required to subsidize their health benefits. So if you furlough an employee on March 15th and their benefits run through the end of March, they will be eligible to elect COBRA on April 1st, and you are not required to subsidize that health insurance benefit financially. Furlough also qualifies the employee to be eligible for a special enrollment for individual health insurance. So if an employee does not want to retain their group health benefits due to cost or other situations, they will be able to obtain individual health insurance for themselves and their family due to a qualifying event and be eligible for a special open enrollment period through any of the governmental websites associated with healthcare. So furloughing is an alternative to laying an employee off and removing them from payroll. And it is something you should consider and work with your CFO and your upper management to determine which employees you would like to retain through furlough and which employees you would like to terminate. So now we are going to review the parameters for the paid sick leave and the rates of pay and everything associated with the paid sick leave. So if an employee qualifies under the 5 types of qualifying events for the paid sick leave, and you do not have a current exemption, this is the rates of pay and the number of weeks associated with this paid sick leave. So the first 2 weeks that an employee is eligible for the paid sick leave, the employer is required to pay their regular rate of pay. Again, we're going to review that small businesses with fewer than 50 employees may qualify for an exemption. But the first 2 weeks are going to be paid at their current rate of pay. Weeks 3 through 4, they're going to require employers to pay 2/3 of the employee's regular rate of pay. If they are a full-time employee, that is 2/3 of a 40-hour week. And we'll get into the guidelines for part-time. Weeks 5 through 12 is part of the extended paid leave. And again, you're required to pay 2/3 of the employee's regular rate of pay. So how does an employee determine, or how does the employer determine how long the employee is eligible to be on the paid sick leave? Are they eligible to be on for 2 weeks, for 4 weeks, 6 weeks, and so on? So we went over the 5 reasons why an employee may qualify for paid sick leave. We can refer back to those. I placed the numbers next to each of the reasons. So if you have an employee who falls under the qualifying events 1, 2, 3, or 4, in review, they are currently experiencing symptoms. They're taking care of someone who has symptoms. They have childcare issues due to closures. Anything outside of the number 5 reason, which was the expanded Secretary of Health qualifications, those employees will be eligible for a minimum of 80 hours of leave. For part-time employees, They will also be eligible for the number of leave that an employee works on an average of a 2-week period. So if you have an employee who is part-time and they work their previous 2 weeks, they work 10 hours and 20 hours, you're going to take the average of those two, and they'll be paid based on those number of hours. If an employee qualifies under the leave number 5 that was reviewed, the full-time employee is eligible for up to 12 weeks of leave, 2 weeks of paid sick leave at their full rate of pay, and 10 weeks of paid expanded family medical leave at 40 hours a week, which is your full-time employees. Your part-time employees will take an average of the number of weeks that they're out, and you basically backdate that to the number of hours they've worked on average, and that is how you determine their paid sick leave. So how are you calculating this rate of pay for employees? This is really important because they have set in place maximums to try to minimize the exposure to employer. And later on, when we are discussing the federal assistance associated with this, the maximums placed on the employers, the government's reimbursement of these items will have very similar maximums. So if an employee qualifies under reason 1, 2, and 3, they are being paid at their regular rate of pay or minimum wage, whichever is higher. But there is a $511 per day cap, or $5,110 over a 2-week period would be the max. This will come into place for your higher wage earners. If an employee qualifies under reason 4, they're entitled to be paid 2/3 of their regular rate of pay, up to a max of $200 per day, or again, $2,000 over the 2-week period. If the employee qualifies under leave reason number 5, again, they are paid at 2/3 of their regular rate of pay or minimum wage, whichever is higher. The daily maximum is $200 per day, and the maximum over a 12-week period is $12,000. So that means if they are they eligible for a 12-week leave, over the 12-week period, they are not entitled to more than $12,000 of overall paid leave. Okay. Another stipulation for the act is that this paid time leave does not carry over from 1 year to the next. This act is in place through December 31st of 2020. So whatever an employee was entitled to will end on December 31st, 2020, which means if they were in the middle of their paid leave time and they exhaust that time frame, it does not carry over to the next year. Also, an employee is eligible to elect to substitute any accrued vacation leave, personal leave, medical or sick leave. And as an employer, you will review with the employee based on your employee handbook what that time frame is. If you don't currently have an employee handbook, that is one of the items that our firm can assist you with. If you don't have one in place, we can go ahead and get your handbook in place, get it written, define all of your criteria, and get those delivered to your employees for signature so they certify they understand the guidelines. So most employers think of paid sick leave, they think of FMLA. FMLA is Family Medical Leave Act. So to start, we just want to go over the parameters on which businesses will be affected by FMLA. Currently, FMLA is a current program, and they determine whether or not an employer has to abide by these guidelines based on the number of employees within a certain territory. So if you're an employer who has less than 50 employees and all of your offices are farther than 75 miles from each other, you will not be required to follow any of the FMLA guidelines. If you are an employer who has more than 50 employees, and it can be at multiple locations where they calculate this. I'll give you an example. If you have an office in Fort Lauderdale and it has 30 employees, and then you have an office in Jacksonville that has 30 employees, technically you have 60 employees, but because the two locations are more than 75 miles apart from each other, they will calculate the number of employees based on each location, which means you will not be required to follow the FMLA guidelines. Now, if you have an office in Jacksonville and you have 60 employees, and you have an office in Fort Lauderdale that has 20, your Jacksonville office will have to abide by the FMLA guidelines and your Fort Lauderdale office will not. So if you have questions pertaining to whether or not you believe that your business is required to follow the Family Medical Leave Act, we are more than happy to answer any of those questions. As an employee, there are certain things that you have to hit as a milestone, even if you work for a company who is required to abide by the guidelines of FMLA. You as an employee must have worked for your company for at least 12 months or a total of 1,250 hours. So if you're an employee who has worked for the company for a year and a half, but you have not retained enough hours, then you will not, even though you are part of an employer who requires FMLA, if you do not qualify as an employee, you as the employee will not be eligible for FMLA. Commonly asked questions associated with FMLA. Must an employer grant leave to an employee who is sick or who is caring for the family member that is sick? So the difference between FMLA and the FFCRA is that an employee, if they are entitled to FMLA, as the employer, you're required to hold that employee's position for a 12-week period of time. So you can't eliminate their position for a minimum of 12 weeks. Now, that doesn't necessarily mean that it's paid sick leave if they don't qualify under the expanded paid sick leave. That just means that their position cannot be terminated officially while they have qualified under the FMLA guidelines. So that's a very important distinction, and that is where a lot of the confusion is coming from, and we are more than happy to answer those questions. This is the biggest question I've received over the last 3 weeks. If an employee decides to stay at home under the FMLA leave to avoid getting the pandemic or the COVID-19. So if an employee chooses to stay home, not because they are caring for a loved one, not because they have current symptoms or have been placed on a quarantine, but that they just do not want to put themselves in a position to be in contact with COVID-19, they do not qualify for FMLA and they do not qualify for the paid sick leave time. So leave taken by an employee for the purpose of avoiding exposure will not qualify them for any of the provisions that we have discussed. Additional FMLA questions. May employers change their paid sick leave policy? Yes. So this is very, very important. If you do not have a documented paid sick leave in a handbook, or you have one and maybe it is a little too extensive for the current conditions, you are entitled to change these paid sick leave. Some of the parameters you want to just make sure is that you make sure that you do not discriminate in any way based on race, sex, age, which is any age over 40, color, religion, national origin, disability, or their veteran status, because that will put you in a very compromising position. But as long as you are staying within those guidelines, you may update your employee handbook and change your vacation time, sick leave, and all of the qualifications for your employees within your handbook. I do recommend that if you are going to make changes, You make sure that the employee is notified. You can confirm that they were notified and that the employee has an online access to this employee handbook. Our practice at T. Spencer Samuels, we actually provide all of our employers with a free online HR portal where they can have all of these documents with employee access to all the documents for the employer. It's a great program. And if you don't have a system set up like this, then make sure that you are receiving emails for confirmation of receipt so that you have documentation. So as an employer, can you request that an employee stays home? Yes. So you can require the employee to stay home. You can require the employee to take all of their paid sick leave time, vacation time before the paid sick leave is enacted or where their starting date for the paid sick leave. So there are a lot of employers who are doing this right now. They're putting a strategy in order so that as they have these situations come up, that they are ready. Now I'm going to review the federal government financial assistance associated with employers who are required to pay the paid sick leave. So while employers have to pay initially the cost associated with the paid sick leave, the federal government will be assisting employers on reimbursement of this paid sick leave under two different situations. So if it is a payroll paid sick leave, so the portion of the employee's paycheck that is actually their pay, the employer is going to receive a credit on their payroll tax as they file. So how does that work? So there will be a tax credit against the 6.2% Social Security portion of your payroll tax. So in essence, if you have an $8,000 credit when you go to file your payroll tax, you will use up the $8,000 until it is gone. If you are an employer who offers employee health benefits, the portion that you pay as an employer, not the total cost, but the portion you pay will be credited on the Medicare tax portion. So your payroll paid sick leave will be credited on the Social Security side, and the subsidized health insurance portion will be credited on the Medicare payroll tax side. So of course, there are parameters for the maximum the government will assist you with the paid sick leave time. So just like some of the other pay requirements by employers, the credit that you will receive does have a $511 per day maximum credit, and it will be $200 per day for workers taking leave to take care of another person, but these specifically line up with the amount or the maximum the employer is required to pay. So therefore, you should be getting 100% credit for the monies that you had to front to pay for the paid sick leave time. The only difference is that the federal government will not credit more than $10,000 for any one employee. So if an employee is out for 12 weeks and your 12-week maximum was $12,000 for that employee, the government will credit through the Social Security payroll tax portion up to $10,000 of the $12,000, but it does cover a very large portion. And just to review, you can see highlighted below any credits for the amount the employer pays towards the subsidized health insurance will be credited on the Medicare payroll tax. So these are different provisions that you can put into place to alleviate abuse of this new paid sick leave. A lot of this has been updated since I presented the presentation on this, and some of them are not as realistic as others. You know, if you have an employee who, let's say, qualified for FMLA, in previous situations, you would request a 30-day notice. You would ask for second and third medical opinions, which is very unheard of now because 9 times out of 10, the employee can't get more than one medical opinion. I would say that our clients have an HR portal where they do their enrollment and where they maintain all of their records electronically. If you don't have a system in place, it's very important that you begin to document. Make sure that you have a personnel file for each employee, and you just want to document what is the qualifying event, the day that they requested the leave, how long are they estimated to be out, how much of an employer have you calculated for the amount of time that they're out, and keep very good detailed records of your personnel files to ensure that when everything settles back down, we do not have any issues with the Department of Labor. So I think really that is the best way, or best system right now to prevent any abuse. One of the items that I wanted to review with employers is the COBRA guidelines. Why do I want to review this with you? Well, when the world is crazy and we have a pandemic and we have all the paid sick leave and having to calculate time and personnel files, sometimes we let the simple things fall through the cracks. So I want to just review very quickly that employers are required to notify employees within 14 days of any type of change to their health benefit. So what does that mean? If you furlough an employee, if you terminate an employee, if you're reducing their hours, you need to make sure that your COBRA provider, which is either your broker, because we do COBRA administration for some of our clients, your carrier, wherever your health insurance is, or your third party who handles your COBRA, you need to ensure that they are notifying your employees, because it is against the law to wait 30, 45 days to notify your employees of their qualifications, eligibility, and outline of what their rights are for their coverage for their health benefits. Okay, so whether it's a voluntary or involuntary termination or a furlough, again, if you reduce an employee's hours from 40 to 20 and they're no longer eligible for benefits, of course, there are things that an employee would notify an employer for, but as the employer, you're still required to make sure once they disclose a COBRA qualifying event that you have that packet sent to an employee within a certain time frame. So if there is a death of an employee, divorce or separation, any change in dependence, if an employee qualifies for Medicare, these are all different qualifying events for COBRA. And with all the changes in personnel, you are going to want to make sure, again, that you're keeping record of what you sent and when you sent it. So if an employee has a change in their eligibility, excuse me, the first thing that they're going to ask you as an employer, if they have a situation where they may not be eligible to stay on your group benefits, or it's not a subsidized benefit any longer due to change of hours or termination, they're going to panic. You want to make sure you have a system in place. So you can actually print off this page or create your own, but there are options for health insurance for your employees. The first is COBRA. We have discussed prior. If an employee has a reduction in hours, if they're furloughed or terminated, they will qualify for COBRA benefits through you as the employer. So we just want to make sure we have that paperwork to them with an outline of their benefit and the cost. Because they do have a change in qualifying event through termination, like we said, or furlough, they will qualify for what's called a special enrollment period. The special enrollment period basically means through the healthcare exchanges, that employee is qualified to buy health insurance, dental, vision for themselves and their families due to loss of coverage. So if they need assistance with that, I have a link here One of the things I wanted to stress, if you are a part of one of our associations, is that your association has provided benefits for its members and its members' employees. I have put the link in here. This link will take you to a portal where, under a qualifying event, you will be able to provide your employees with access to all the healthcare, dental, critical illness, guaranteed life insurance, and other benefits that are offered through your association. We are more than happy to answer questions. If an employee has a change of status and their spouse has coverage, they will qualify to be added to their spouse coverage. And if it is a true financial hardship, they can apply and may be approved for Medicaid or CHIP, and I have put the link there for you. So if an employee is eligible for this special enrollment period, there are different things that they can list as qualifying events to enroll in this coverage. If they have, obviously, loss of health coverage through their employer, Medicaid, Medicare, or any kind of CHIP programs, which is the Children's Health Insurance Programs, they will qualify for enrollment. If they've had any changes to their household, marriage, childbirth, adoption, divorce, or death, again, qualifies. If they have moved outside of the coverage area zip code, so they moved from Florida to New York or from New York to California, they will qualify for open enrollment, even if they do not have any loss of coverage. And then, of course, there is other qualifying events, like if they have a change of income and can no longer afford their coverage. So I wanted to point out, due to COVID-19, for employees or for members who did not purchase any type of health insurance previously, so you don't have individual, you don't have group, but you can enroll because we're outside of the national enrollment. There are several states within the United States, and these are being added. So I will be adding these to the association websites so you guys can reference this. And with the association portal, if you live in one of these states, you can go on the portal provided to you by the associations and enroll in health coverage under this provision of a special enrollment period, even if you did not have previous health insurance, which is really, really important. So this is a list of the states, and they are expanding it daily, and I will keep you updated. So your association wanted to make sure that all of its members had access to whatever health benefits that they chose to elect. So as a company, you can see here where you can get information on group products. If you are an individual and you need to enroll in some type of health coverage, this is all the carriers that offer health coverage, no matter what zip code you live in. And if it is one of the states that has expanded their special enrollment period due to COVID-19, the system will know, and it will allow you to enroll in those benefits for yourself, for your employees, and their families. I have enclosed the hyperlink, so an employee will just click on this hyperlink, or you as an employer, and it will take you to this member benefit site provided by your association, and you can actually shop all the carriers that are available in the market for different health insurance benefits. So again, through your association and the hyperlink, these are the different benefits you can purchase through the portal for your association. So you can purchase individual health insurance. So if you qualify for a governmental subsidy, or you need to find out if you do, then you are able to, instead of going to the healthcare.gov site, which is kind of crazy, you can actually purchase it through this portal, and it will calculate your subsidy just as the government programs do. Or if you are buying direct, you do not qualify for a subsidy, you can also buy individual health coverage through this portal. If you need short-term medical, which is just a temporary time frame, 30, 60, 90, 180 days, you can purchase catastrophic policies to cover you and your family. They also offer dental, vision, group health, if you're an employer, accident, critical illness, guaranteed life insurance, a variety of cancer policies, and disability can all be purchased on this portal. We have a team of 35 people that are able to help and assist you with any questions that you might have associated with the different benefits, the carriers, the rates, whether you qualify for subsidies. We have a whole team here to help you with any questions that you might have. And that is a resource through your association. If you have any questions associated with this webinar, we really do encourage you to reach out to us. This is our email address. These are our cell phone numbers. We are available anytime that you need us. We are also very well versed in all of the loan programs, and we have other webinars that we have put out to members associated with the PPP, the EIDL, and other loan programs that have become available through the federal government. If you have questions on the PPP, which is the Paycheck Protection Program, we do have an additional webinar that goes through the entire program, what you need to qualify, what documents you'll need to retain, and resources to send you in the right direction to apply for that loan. So if you don't have that webinar, we're more than happy to email you that link. If you have any questions associated with the FFCRA in this webinar, we again encourage you to ask questions. There's no question that's too silly. We are so happy to be able to present a series of webinars on all different topics associated specifically to employers to help navigate through this difficult time. So we are here for you. We are here to help. And we thank you for taking the time to watch this. Have a great day.